orientation to the high fidelity rooms and the equipment in them. All of the rooms are the same with the exception of the ORs. The 4 high fidelity rooms on this hallway are all the same with the same features. Your patient will either be on a stretcher, which is covered in a different video, or a hospital bed. The hospital bed, they all work similarly, meaning that the head and the foot rise and fall are on the outside of that handle. Some of your beds will be unlocked to raise and lower here, or you may need to go to the panel at the foot of the bed where you can do bed high and bed low if the rail controls do not work. You have 4 bed rails. You have lower and upper. For those bed rails, they are on a track that you have a release button, and so you'll want to make sure that it says push on it. It's very easy to find, and then that bed rail will fold away toward the head of the bed or toward the foot of the bed, and then you may push that underneath if you need that to be out of the way. The foot rails are very similar in that you're going to raise them as such, and then you have the release button to lower them and go under the bed. Your brake is here, so if you were to need to move the bed, you would disengage the brake to the neutral or the steer position. Neutral is flat. It's usually the easiest way to move. And then you would re-engage the brake once you have the bed moved to the position that you need. For a code, your headboard will remove off, so you may remove this, and then you can get to the head of the bed for intubation and those types of things that you may need for the code. In the room, you will have a power column such as this. This is referred to as the power column. It does house your suction, your oxygen, and your medical air. So once you turn this on, you will have air coming out, as well as if you turn on your suction, you will have your suction coming, working as well. Also in the power column, you'll have your call light system. So you can give this to your patient, and it is a simulated call light system, meaning that it only goes to the wireless panel that we have in the control rooms. You'll have an IV pole with an Alaris pump, which you can look at the orientation video for that. Your sharps container will also be on this wall along with your gloves. Your patient monitor, which will be covered in a different video, will be on here, or it will be on the bedside table, that depending on the type of simulator that you're using. Each room has a silver table, such as this. This is what we put all your supplies on that you may need for the simulation, not including your medication supplies. Those would be in the medication room that was covered on that video. So if you need something that you think you need but is not here, then you would just simply ask for that over the intercom, and we would get that for you. Each room has a sink, hand washing station, extra size gloves. The drawers and cabinets in these rooms will not have patient specific supplies. So there's not any reason for you to go searching in these for something that has to do with the simulation. All of that will be out for you. Here you have a charting station. So this is where you can either do your paper charting or your electronic charting. It has the ability to have a power cord as well as internet connection, both wired and wireless. Each room has a phone system that has, it'll be at the patient's bedside. This is the phone that you will use to call the different departments. And the phone numbers that you are to call are room specific. So you need to follow the numbers that'll be posted in your room. And it'll look something similar to this. either on the whiteboard or right above the phone on the wall. You do have a camera and recording system in here. We have 2 cameras and a mic kit, and those are connected to a box over here on the wall. You are not to need to do anything to that box. Just know that that doesn't have anything to do with the simulation.